Welcome everyone to another discussion on the Tutor Med channel. My name is Dr. Obin Frimpong, and in our previous video we looked at the overview of the lymphatic system. Today we want to talk about the lymph nodes and the parts of the body they drain, particularly the superficial lymph nodes. I mean the lymph nodes which have been placed superficially. Following this lecture to the end will enable us know which lymph nodes to examine. For example, if a patient has a right gluteal abscess, which lymph node would you examine first? And so I encourage you to stay tuned to the end. All right, friends, let's quickly get started. We want to begin by having a brief discussion on the structure of the lymph node, paying attention to the lymph vessels which carry lymph towards the lymph node, and then the lymph vessels which carry lymph outside of the lymph node. Remember that we established in our previous lecture that lymph nodes have been placed along the paths or along the course of lymphatic vessels, and their aim is to, or their function is to screen the lymph that is running through the lymphatic vessels. Now, sometimes in screening for them, they identify a foreign substance, and because of that they enlarge, and that is called lymphadenopathy. Now this foreign substance could be a microbe like bacteria, virus, fungi, or it could be a cancerous cell which has metastasized. Okay, and so if it is from a microbe, then the lymphadenopathy is usually described as a reactive lymphadenopathy. And if the lymphadenopathy is as a result of a cancerous cell, it is usually described as infiltrative lymphadenopathy generally. And so we have two types of lymphadenopathies. We have reactive lymphadenopathy and then infiltrative lymphadenopathy. Now, the vessels or the lymphatic vessels which carry lymph into a lymph node to be screened, they are called the afferent lymphatics or afferent lymphatic vessels. Then the lymph nodes, the lymphatic vessels which drain the lymph out of the lymph node, they are described as the efferent lymphatic vessels. Efferent efferent lymphatic vessels. Good. And so the lymph node generally has two regions. We have the cortical region and then the medullary region. And these regions are made up of various lymphatic cells like B cells, T cells, and their function is to screen the lymph to identify any foreign material. And so like I said earlier on, once any foreign material is identified, whether a microbe or a cancerous cell, the lymph nodes become enlarged, and that is lymphadenopathy. On our next slide, we want to talk about the various or the different types of major regional superficial lymph nodes. So these images show the anterior part of the human body, and this is the posterior part of the human body, the anterior view, the posterior view. And so we want to indicate the major superficial regional lymphatic or lymph nodes. So beginning with the head and the neck, the lymph nodes here in this region, they are the cervical group of lymph nodes. We will look at them into details in subsequent slides, but they work on the head and neck structures, or they screen the lymph coming from the head and neck structures superficially. Then the next group I want to talk about are located in the armpit, medically called the axilla. And so that is the axillary group of lymph nodes. So remember that the head and neck, this, of course, cervical group here, and the axilla in this region, also axillary group of lymph nodes. Good. Then what I want to talk about again is in this region. This region, yes, we have the inguinal group of lymph nodes. The inguinal group of lymph nodes. So really, these are the three major superficial groups of lymph nodes. However, we have others we need to talk about, like the popliteal group of lymph nodes. They are located in the popliteal fossa. So apart from the cervical, the axillary, and the inguinal group of lymph nodes, we have the popliteal group of lymph nodes, or the popliteal lymph nodes. Then, here in this region, in the epitrochlear region, we have the epitrochlear lymph node. So all these are not considered so major. The major ones I've mentioned are the cervical, axillary, and the inguinal. But we need to consider the popliteal lymph node, the epitrochlear lymph node, and then when you get to this region, below the clavicle, they are described as infraclavicular lymph nodes. Some books describe the infraclavicular lymph node as part of the axillary lymph node because they eventually drain into the axillary lymph node. But technically, it is not an axillary lymph node because of its anatomical location. It is not located in the axilla. And so, friends, the point I want to make here is that please keep K in your mind or in your minds. C for cervical, A for axillary, I for inguinal lymph nodes, P for popliteal, and then E for epitrochlear lymph node. Hey, very good. And so, having indicated the major regional lymph nodes, I want to share the general principles regarding their drainage. Which parts of the body do these lymph nodes drain? First of all, it is very easy to appreciate that the cervical group of lymph nodes will drain the head and then the neck. Okay, so the cervical group of lymph nodes, it is very easy to appreciate that the cervical group of lymph nodes will like to drain the head and the neck. So here we are just sharing the basic principles. So it will like to drain, or they will like to drain the superficial parts of the head and the neck. And so cervical lymph nodes here, head and the neck. The second principle here is that we are done with the cervical group. Now we are coming to the axillary group and then the inguinal group. Yes. So now the second principle here is that after you have been able to appreciate that the head and neck structures superficially are drained by the superficial cervical lymph nodes, next step is to draw an imaginary line through the umbilicus anteriorly, and then when it comes to the posterior part, locate the iliac crest. This is about their location, and then draw an imaginary line through the iliac crest. And so anteriorly, your landmark is the umbilicus, and then posteriorly, your landmark is the iliac crest. And so here we are going to show some principles or some general principles. Now, as a general principle, anteriorly, the part of the body above the umbilical line is drained chiefly by the axillary lymph nodes. The part of the body above the umbilical line is drained by the axillary lymph nodes. Good. That is principle number one. A general principle, we would state the exceptions later. So the part of the body above the imaginary line you've drawn through the umbilicals is drained by the axillary lymph nodes. And then posteriorly, the part of the body above the plane you've drawn through the iliac crest is also drained by the axillary lymph nodes. So we are done with the axillary lymph nodes. So we are saying the axillary lymph node, the general principle, please. We would state the exceptions later. The general principle is that the axillary lymph nodes will drain above the umbilical line, anteriorly, and then above the iliac crest, posteriorly. And so you come to the part of the body below the umbilical line. And so the part of the body below the umbilical line, so including the perineum, the lower, excuse me, please. Yes, including the lower parts of the body will be drained by the inguinal lymph nodes. Then, posteriorly, the inguinal lymph node will still drain the parts of the body below the iliac crest. And so it's so simple. Anteriorly, you use your umbilical line. Posteriorly, or posterior view, the back, you use your iliac crest. So anteriorly, above the umbilical line, and then posteriorly above the iliac crest is for the axillary lymph nodes. And then anteriorly below the umbilical line and then below the iliac crest is for the inguinal lymph nodes. So inguinal lymph nodes below umbilical line anteriorly, and then below the iliac crests posteriorly. Very good. And so these are the general principles. Once you have these general principles in your head, I think it is a good start. Now you might be wondering, so what about the popliteal and what about the epitrochlear? So we will state the exceptions later, but kindly keep these principles in your minds. Now let's see the exceptions to these general principles we have established. The first is that although we have established that the trunk or the part of the body above the umbilical line is drained by the axillary group of lymph nodes, kindly note that you see this is the position of the breasts. And by principle, the breast is also above the umbilical line, and so it should be entirely drained by the axillary lymph node. And here is the first exception. I should note that the medial half, if you divide each breast into two halves using a longitudinal plane, we have the medial halves of the breasts. Let me use a different color here. And then the lateral halves of the breasts. Now, the exception here is that it is only the lateral halves of the breast that is drained by the axillary group of lymph nodes. So that is the exception. The medial half of the breast, or the medial halves of the breast, as I am indicating, they are drained by the internal thoracic lymph nodes. And so, assuming we meet a question that says a 25-year-old woman complains of breast pain in the right medial half, or in the medial half of her right breast. It was associated with maybe fever, chills, rigors, and then an ultrasound scan diagnoses a breast abscess. Which of the following lymph nodes will be likely enlarged? The principle here is that, yes, it is true that the part of the body above the umbilicus is drained by the axillary group of lymph nodes. But because the right medial breast is the one which has the abscess, by principle or by the exception, we are saying that that is drained by the internal thoracic lymph nodes. And so we would rather have an internal thoracic lymphadenopathy, which would probably be reactive, a reactive lymphadenopathy, rather than having a reactive axillary lymphadenopathy, because the abscess was found in the right medial half. And so that is exception number one, that the right or the medial halves of the breast are drained by the internal thoracic lymph nodes. Now, the second principle or the second exception is that the epitrochlear lymph nodes, the lymph nodes I put here, in truth, the epitrochlear lymph node will eventually drain into the axillary lymph node. But let me say this. If I divide the forearm and the hand into two, like this, I will have the ulnar side and then the radial side. So if I come here, this is the lateral or the radial side, and this is going to be the ulnar side. Now, the ulnar side of the hand and the forearm, it makes sense to think that they will drain into the epitrochlear lymph node. Look at where the epitrochlear lymph node is. And so it will drain this part of the hand and the forearm. And then from there, it will eventually drain into the axillary lymph nodes. So the epitrochlear lymph node will eventually drain into the axillary lymph node. So the question is, which lymph node is expected to drain the radial half? This lymph node is likely to be drained by the infraclavicular lymph node. Or chiefly, it will be drained by the infraclavicular lymph node. And the infraclavicular lymph node, just like the epitrochlear lymph node, will eventually drain into the axillary lymph node. So please get the exception that it is true, yes, the axillary lymph node will drain this part, but they won't drain that directly. They will drain the ulnar or medial side via the epitrochlear lymph node, and then the lateral side via the infraclavicular lymph node. So that if we are told that a man develops an abscess here, which lymph node will you first examine? The first lymph node you examine is probably the epitrochlear lymph node, although it will eventually dump it into the axillary lymph node. Then another last exception is the drainage of the inguinal lymph node. Remember, we mentioned the popliteal lymph node. So by principle, or by our general principle, this part of the body is supposed to be drained by the inguinal lymph node. But if I divide the leg and then the foot into two parts, you'll agree with me that this will be the medial parts, okay? And these are the lateral parts. So the popliteal lymph nodes drain the lateral parts of the leg and then the sole of the foot, the popliteal lymph node. Then the medial side of the leg and the medial part of the foot will follow our general principle. So please note that the exception to the inguinal lymph node drainage is that the popliteal lymph nodes take care of the lateral aspect of the leg and then the sole of the foot. So that in a question, if you are told that a diabetic patient develops a boil on the lateral shin and he has lymphadenopathy, which of the following lymph nodes are expected to be enlarged? The answer will be the popliteal lymph node, because the location of the infectious process is on the lateral aspect of the leg. And so in our next slide, let's see the cervical groups of lymph nodes. The cervical groups of lymph nodes. Now, I'll go through them one after the other, beginning from the back. Remember that I showed you a picture of the front view and then the back view. And so from the back, we have this group of lymph nodes. This is called the occipital lymph nodes. Then the nomenclature of the lymph nodes in the cervical region is based on their anatomical location. And so this is located somewhere around the occiput and is sometimes called the nuchal lymph node because it's located close to the nape of the neck, nuchal lymph node. Then from that place, I move to the ear. So this one ideally is behind the ear. It is not on the auricle of the ear, but it is behind the ear here, the mastoid process. This, because it is behind the ear, it's known as the post-auricular lymph node. Again, based on its anatomical position. So post-auricular lymph node or the retro-auricular lymph node, sometimes called the mastoid lymph node. Then we have the pre-auricular. It's before the auricle of the ear. So that is the pre-auricular lymph node. The pre-auricular lymph node. Then we have this place or this lymph node that is closer to the mandible and it's underneath it. And so this is the submandibular lymph node. Submandibular lymph nodes. Then yes, we have this group of lymph nodes below the chin, and chin in Latin is mentum. So that would be the submental lymph nodes. Okay, then deep within this, the sternocleidomastoid muscle, we have the deep cervical lymph nodes. Although I am talking about the superficial lymph nodes, allow me to talk briefly about the deep cervical lymph nodes. So we have the omohyoid lymph node, and then the jugulo. This is actually the jugulo or the jugulo digastric lymph node, and this is the omohyoid, the jugulo-omohyoid lymph node. So the jugulo-digastric and then the jugulo-omohyoid lymph node. Good. And so let's briefly talk about them. So based on the position of the occipital lymph node, it makes sense to think that it drains the back of the scalp. So around this part, the back of the scalp. And so if you have a scalp abscess in this region, the occipital lymph nodes may enlarge. Then we come to the post-auricular lymph node. The post-auricular lymph node will drain the part of the scalp which is behind the ear. So this part behind the ear, and because it's also situated just below or behind, I wanted to say, the auricle, it sometimes drains the auricle and some parts of the external auditory meatus. The pre-auricular lymph node, based on its position, will drain the part of the scalp that is above the ear, before and above the ear. That is the pre-auricular lymph node. Then I want to skip the submental lymph node a bit. Then we have the submandibular lymph node a bit. We have the submental. For the submental, it drains the anterior part of the tongue, especially the tip, the tip of the tongue. So if there is a tongue, the submental lymph node would like to drain this part of the tongue, okay? And then it drains the anterior part of the floor of the mouth, your lower incisors, and then the center of your lower lip, this way. The skin of the center of your lower lip. Apart from these regions, the general principle is that the submandibular lymph node drains almost everything you can think about. Drains almost everything. Everything that the submental did not drain. Okay, then this is the supraclavicular lymph node, and this is the infraclavicular lymph node I spoke about. And so if you take into consideration, if someone has a gum disease, someone has a gingivitis, yes, and so this is the infraclavicular lymph node we spoke about earlier. Yeah, so I was saying that assuming you have a patient with gingivitis. Gingivitis is inflammation of the gum. It is also a periodontal disease. Someone has a toothache, a bad infection of the gum, and you are asked which lymph node are expected to be enlarged. Your best guess is that it is the submandibular lymph node. It drains most parts of the superficial structures of the head and neck. Good. And so, from the cervical lymph nodes, we want to move to the axillary lymph nodes. Now, for the axillary lymph nodes, we have the group of lymph nodes which are closer or which lie within the region of the humerus. That is the lateral group of lymph nodes. Lateral lymph nodes. Then we have this group, which is closely related to the latissimus dorsi muscle. This is the posterior lymph nodes. Then this is the central lymph node. Central lymph node. Then we have this group closely related to the pectoralis major. That is the anterior lymph nodes. And then this group here is the apical group of lymph nodes. So generally, we have 5 groups of axillary lymph nodes. We have the apical group of lymph nodes, which will eventually receive from all 4 lymph nodes. We have the anterior group of lymph nodes, the lateral group of lymph nodes, the central group, and then the posterior group. Now, I want to say that, you remember we mentioned that the part of the trunk, okay, if this is the head, neck, and then the hand, we drew a line through the umbilicus. Remember we said that this part of the body is drained by the axillary lymph nodes, and then actually the lateral part of the breast is also drained by the axillary lymph nodes. Now, the group of lymph node which accepts from what I've just drawn is actually the anterior group of lymph nodes. So if someone has a breast cancer here and then it spreads to the axillary group of lymph nodes, the first one that is likely to enlarge is actually the anterior group of lymph nodes. It's also known as the pectoral lymph nodes. Then again at the back, if this is the back of the patient, remember what we said, that if we drew a line through the iliac crest, the part of the back above the iliac crest is drained by the axillary lymph node. Can you guess which of the lymph nodes will drain the back? Of course, it is this guy, the posterior group of lymph nodes. They will drain this part of the body. And so if a diabetic woman has an abscess on the back here, and you are asked which group of lymph nodes will be enlarged, it is likely to be the posterior group of axillary lymph nodes. Very good. And so remember that we said the epitrochlear group of lymph nodes drain from this side, and from there they drain into the axillary lymph node. So you can guess that the axillary lymph nodes which receive the epitrochlear group of lymph nodes is actually the lateral group of lymph nodes. And so the lateral group of lymph nodes, the posterior group of lymph nodes will all drain into, and the anterior group of lymph nodes will all drain into the central group of lymph nodes. I will take that again. The lateral group of lymph nodes, the anterior group of lymph nodes, the posterior group of lymph nodes will all channel to the center, and then the central group of lymph nodes will channel its contents into the apical group of lymph nodes. Now we move to the inguinal group of lymph nodes. Now this is the groin, and as you can see, we have 2 groups of inguinal lymph nodes. We have the horizontal group, like that, and then the vertical group of lymph nodes. So the inguinal lymph nodes actually is made up of the horizontal group of lymph nodes, and then the vertical group of lymph nodes. And so what is their principle, or what is the principle behind their drainage? Where or which part of the body will the horizontal group of lymph nodes drain, and then how about the vertical group of lymph nodes? Now, if you study the arrangement of the horizontal, let me add some here. If you study the arrangement of the horizontal group of lymph nodes, you can see that these group of lymph nodes are closer to the body, and so these will be the medial group, and then these will be the lateral group. Okay, and so the medial group, these ones, they will receive lymph from the part of the trunk that is below the umbilicus. Okay, so below the umbilical line will be received by the medial group of lymph nodes. So the medial group will be received by them, or will receive the infra-umbilical region. So the anterior abdominal wall infra-umbilically, okay, below the infra-umbilical region, And then the perineum, this part, perineum, receive lymph from every part, including the scrotum of the male. So if the male has a scrotal abscess, the medial group of inguinal lymph nodes are likely to be hit. And then the upper, or I wanted to say the lower half of the anal canal. Then, where do you think the lateral group of lymph nodes will drain? Remember the back? We said that if we drew a line through the iliac crest, the parts of the back below the iliac crest will be drained by the inguinal lymph node, right? And then that will be drained by the lateral group. And so the medial group will drain the part of the abdominal wall, anterior-abdominal wall below the umbilicus, the perineum, the lower half of the anal canal, while the lateral group will take care of the back. Then the vertical group would drain the legs, like I said, except for the portion of the leg that is drained by the popliteal lymph node. And so really, this is the various, these are the various lymph nodes and then the parts of the body they drain. So if I'm to illustrate this here, this is what I'm going to say. Draw this thing here. We have the medial group, okay, and then the lateral group here. Then we have the vertical group. So we are saying that the medial group will drain this part of the abdomen, and then the perineum, external genitalia, except the testes, of course, of the man, and then the upper half or the lower half of the anal canal. Then the lateral group will drain this part. Then when it comes to the vertical group, it drains the part of the lower leg, okay, the lower leg, except for the region that is drained by the popliteal lymph node. And so when someone has a right gluteal abscess here, automatically you would expect that the lateral group of horizontal inguinal lymph nodes should be enlarged. If someone has an abscess here, you expect that the vertical group of lymph nodes should be involved. If someone has a scrotal abscess here, you should expect that the medial group of inguinal lymph nodes will be involved. If someone has Bartholin's abscess of the vulva, we should expect that the medial group of inguinal lymph nodes, the horizontal group, would be involved. If someone has an abscess here, you should expect that the anterior group of axillary lymph nodes will be involved. If someone has sinusitis, you should expect that the submandibular glands will be involved. And so those are the principles of superficial lymph node drainage. And remember that by principle, like we established last time in our previous lecture, just like all superficial lymphatic vessels will drain eventually into deep lymphatic vessels, all superficial lymph nodes will also eventually drain into deep lymph nodes. And so this is the end of our lecture. I trust and hope that it made sense. Kindly support the channel by liking and sharing this video, and then hitting your notification bell so that when we post new videos you'll be updated, and then join the community. So see you in our next lecture, and until then, have a good day.